Testing 1, 2, it works. Good morning. The purpose of today's meeting is to assign our newest member, Bill Flores, Congressman Flores of Texas, to subcommittees and to establish a fifth subcommittee of the House Veterans Affairs Committee. First, let me welcome my good friend, Representative Bill Flores, back to the committee. And as many of you know, Bill served on this committee for several years. We sat next to each other for years, including time as chairman of the Economic Opportunity Subcommittee. I was pleased when he expressed an interest in returning to the committee. In a few minutes, we will assign him to the Subcommittee on Health and Economic Opportunity, and I am confident that the subcommittees will benefit from Bill's experience and dedication to veterans. Bill, welcome back. Second part of our business meeting is to establish the establishment of a subcommittee to oversee VA's technology modernization. Service members deserve a modern, interoperable electronic health record that facilitates a seamless transition from active duty to VA. Veterans and taxpayers expect the new EHR to be delivered on time and within budget. The program's estimate of $15.8 billion over 10 years makes it VA's largest IT undertaking, and the American people rightfully expect Congress to safeguard their investment. VA's track record on rolling out IT projects is troubling. With such an important project and a huge amount of taxpayer money on the line, VA has to get EHR modernization right. It is incumbent on this committee to conduct aggressive oversight and hold VA leadership accountable. To enhance this committee's oversight capacity, I am, with the ranking member's support, proposing that the committee establish a fifth subcommittee on technology modernization. The subcommittee will have oversight responsibility over VA's information technology modernization programs, focusing primarily on the electronic health record modernization program. Congressman Jim Banks of Indiana will serve as chairman of this new subcommittee. Representative Banks, who presently serves as a naval reservist, will bring valuable experience with DoD healthcare to the subcommittee. Additionally, Jim will be a member of is a member of the House Armed Services Committee that oversees implementation of the MHS Genesis, DoD's version of the Cerner electronic health record, and will bring that experience to the subcommittee. I'm also pleased that Representative Mike Kaufman volunteered to bring his experience to the subcommittee. Representative Kaufman is a former Army and Marine veteran, and the committee and chairman of the House Armed Services Military Personnel Subcommittee. As chairman, Mike directly oversees DoD's implementation of MHS Genesis. Finally, Representative Lieutenant General Jack Bergman of Michigan also volunteered for the new subcommittee. Marines know not to volunteer, but he did anyway. As you know, Representative Bergman, also a former Marine, is chairman of the Oversight Investigation Subcommittee, which currently has jurisdiction over VA's information technology programs. General Bergman will bring to the Technology Modernization Subcommittee his knowledge of VA's IT programs, including EHRM program from the onset. I want to thank members for volunteering their talents, time, and expertise to this endeavor. I'm excited and optimistic that the Subcommittee on Technology Modernization will prove to be an invaluable tool in fulfilling the committee's oversight responsibilities. I now recognize Ranking Member Walls for any opening comments you may have.
Well, thank you, Mr. Chairman, and welcome back, Mr. Flores. It's great to have you on here. We're incredibly proud, as you know, of your time in here, of the bipartisanship and the work that gets done. So it's great to have you back. The Democratic caucus of this committee met last night. The resolutions we'll be offering this morning will ratify those decisions. But I want to associate myself with the chairman's words, and a big thank you once again. This is the leadership that you come to expect from this committee, of establishing on the front end that we are going to be there and be responsible. We've dealt with issues, if they're ranging from Phoenix to the new hospital out in Colorado. And I think having each and every one of you, and again, a thank you to Mr. Banks, Mr. Lamb, and Mr. Peters, and all of the members of this new subcommittee. I think this is a golden opportunity for Congress to exert its oversight authority to make sure that we're not only making sure that this record gets there for our veterans, but we're being those watchdogs for the taxpayers. And this is just a really smart way to go about it. It's been a long time since we've been here. The chairman and I have sat in here, as he said, and allocated a lot of money that at times, and I said at some point in there, never again until we start getting accountability on getting it back. So I commend all of you for doing this. I wish you the best of doing this. It's going to be a decades-long process, as we know. In excess of $16 billion, a timeline that will extend past 2025. And I know that it's good that both of you are young, so you can stick this thing out. But this is the one of setting the tone, and this really sends a very strong message. So I encourage everyone to adopt and to lean into this new subcommittee. It's going to be a great opportunity. I yield back.
I thank the gentleman for yielding. Copies of today's agenda and resolutions are in your materials. The first item on our agenda is a resolution assigning Representative Flores to the subcommittees on health and economic opportunity. Do any members have comments or questions regarding this resolution? Seeing none, I now recognize Vice Chairman Bilirakis for a motion on the resolution.
Thank you, Mr. Chairman. I move to adopt the resolution assigning Representative Flores to the subcommittees on health and economic opportunity.
All those in favor say aye. Aye. All opposed, no. Opinion of the chair, the ayes have it, and the resolution is adopted. Next, we turn to a resolution to adopt amended committee rules which will establish a subcommittee on technology modernization. The proposed rules were provided to members before this meeting, and I'm pleased to say that Mr. Wall's staff and my staff have worked collaboratively on the rules change, and we are now in agreement. In sum, Section 5 of the amended rules would establish a subcommittee on technology modernization. The subcommittee will have oversight and investigative jurisdiction over VA's enterprise technology modernization programs, including electronic health record modernization program. Do any members have comments regarding the proposed rule change? Seeing none, I now recognize Ranking Member Walls for a motion.
Mr. Chairman, I move to approve the resolution adopting the rules of the 115th Congress as amended.
All those in favor say aye. Aye. All opposed, no. The opinion of the chair, the ayes have it, and the resolution adopting the amended rules is adopted. The third resolution we will be considering proposes to set the ratio of the Subcommittee on Technology Modernization at 3 majority and 2 minority members. Do any members have comments regarding the resolution? Seeing none, I now recognize Ranking Member Walls for a motion.
Mr. Chairman, I move to approve the resolution establishing the ratio for the Subcommittee on Technology Modernization.
All those in favor say aye. All opposed, no. In the opinion of the chair, the ayes have it. The resolution is adopted. I ask unanimous consent to consider the fourth resolution, a resolution to appoint the chairman and Republican members of the Subcommittee on Technology Modernization. Without objection, so ordered. A copy of the resolution is included in your packet. Do any members have questions regarding the resolution? I now recognize Vice Chairman Bilirakis for a motion on the resolution.
Mr. Chairman, I move to adopt the resolution to appoint the chairman and Republican members of the Subcommittee on Technology Modernization.
All those in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it. And the resolution designating Congressman Jim Banks as chairman and Representatives Kaufman and Bergman as Republican members of the Subcommittee on Technology Modernization is adopted. Finally, I recognize Ranking Member Walls for any comments he may have regarding his resolution.
Well, thank you, Mr. Chairman. First of all, I cannot stress how important I think this is. I'd like to thank Mr. Lamb and Mr. Peters for choosing to step up and lead this. You're working with wonderful members over here who have been on this issue for quite some time. And so I ask for unanimous consent to offer my resolution approving our ranking member of the Subcommittee on Technology and Modernization.
Without objection, so ordered. Mr. Walls, you're now recognized to discuss your resolution.
I'm fine.
Okay.
Yep,
Any members have questions regarding the ranking member's resolution? Seeing no one, I recognize Representative Takano for a motion on the resolution.
Mr. Chairman, I move that the committee adopt the resolution offered by Mr. Walls, providing for the ranking minority member and minority member for the Subcommittee on Technology Modernization of the committee for the 115th Congress.
All those in favor say aye.
Aye.
All opposed, no. In the opinion of the chair, the ayes have it, and the resolution designating a ranking member and Democrat member for the new subcommittee is adopted. That concludes our business meeting. Members are reminded that immediately following the business meeting, we will turn to a full committee markup. This meeting is adjourned.
Okay. Well done. Mr. Banks, thank you.
Congratulations.
Want to have a Denver.
We're going to take up 60, 66 first, because I need to use the...
That's
Are you guys,
great.
are you
No, that's
guys good
fine,
with
that's
that?
fine. Yep.
Good morning. The committee will come to order. Thank all of y'all for being here. We are here today to consider 10 bills sponsored by members from both sides of the aisle that would address a variety of issues facing our nation's veterans and the Department of Veterans Affairs. I'll forego any further comments and yield to Ranking Member Walls for any comments he may have.
Just want to say once again, and for those members who are sitting here we are again moving things forward to improve the lives of our warriors. I could not be prouder. Smart piece of legislation, debate that needs to happen, and it's always done in here at the subcommittee level, at the committee level, and then we move it to the House. We think things getting done. So thank you, Chairman. Look forward to the markup.
Thank you very much. And as a practice, it is the practice of the committee, members may submit a written opening statement for the record. And we're going to call up 6066 first, because we have some members who have to go to markup in E&C and other committees. I now call up H.R. 6066 as amended. The clerk shall report.
H.R. 6066 to amend Title 38, United States Code to improve the productivity of the management.
The bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. This bill was introduced by former Subcommittee on Health Chairman Dr. Winstrup and amended the current Subcommittee on Health Chairman Dr. Dunn. I am grateful to both of them for their leadership on this important legislation that I believe will increase access to care for veterans who are needing it, ensuring that the VA medical facilities are well-staffed, that VA clinicians are productive, and that barriers to efficiency across the VA healthcare systems are identified and overcome. In particular, the bill would require VA to track and monitor clinical productivity, including through the establishment of performance standards and remediation plans. In doing so, it would allow for the inclusion of value-based productivity models, non-clinical duties like training and research, and factors that impede efficiency like the lack of sufficient support staff or exam room space. It would also require VA to ensure that providers are trained in clinical procedure coding and develop comprehensive staffing models for VA medical centers. This bill is intended to improve VA's ability to provide care to our nation's veterans, not to be punitive or create unfair comparisons between VA and other healthcare organizations that may not face the same challenges as the VA. It was drafted based on recommendation made by various VA Inspector General and Government Accountability Office reports over the years, including one report from last year that called on VA to improve data and monitoring of clinical productivity and efficiency. It also incorporates feedback provided by VA and veteran service organizations. I thank them all for their input and support and encourage all members to join me in supporting this bill. The bill is now open for amendment, and who seeks recognition for the purpose of offering an amendment?
Mr. Chairman, I have an amendment at the desk.
The clerk shall report.
Amendment in nature of a substitute to H.R. 6066, offered by Ms. Custer.
It's unanimous consent that further reading of the bill, reading of the amendment be dispensed with. Hearing no objection, so ordered. I now recognize Representative Custer for 5 minutes to discuss her amendment.
Thank you, Mr. Chairman, and thank you to this committee for its continued bipartisan efforts to improve veteran health care and general quality of life for our veterans. Unfortunately, I have concerns to the underlying bill led by Dr. Wenstrup. While I appreciate the intent of the legislation, there are a number of crucial technical hurdles that have not been accounted for and which could seriously threaten the efficacy of this policy and the mission of the VA. First, there are many information technology concerns that I must voice as ranking member of the Oversight and Investigations Subcommittee. VA's current IT infrastructure is not capable of tracking the type of metrics and performance as envisioned by this bill. It's fitting that just today we created an entire subcommittee to oversee IT modernization. We should not provide additional burdens during the time of radical change at the VA. I also have concerns over the chosen metrics, which I feel still fail to account for the kind of care that the VA provides, care that routinely ranks the VA at the top of veterans patient satisfaction surveys conducted by VSOs like the VFW. Relative value units, or RVUs, may be useful metrics, but it remains unclear if RVUs will account for VA status as a teaching institution. 2 weeks ago, members of this committee attended a roundtable on resolving some of the long-standing provider shortage issues at the VA. One of the issues presented was the inability for current metrics to appropriately quantify and value the time taken by VA physicians to train the next generation of America's physicians. I feel this bill will degrade VA's greatest asset. Additionally, VA physicians and medical providers must take additional time per patient than in the private sector because of the prevalence of comorbidities and the unique cultural circumstances that improve the delivery of health care to our veterans. My amendment would be a common-sense option that will not only require the VA to seriously think about the utility of metrics like RVUs, but to design and implement such a system at a pace that we all know is more appropriate for this agency. I propose a 3-year pilot program envisioned by my amendment that would be conducted at 15 medical facilities that would require the VA to develop the appropriate IT coding and that would establish comprehensive performance standards that will take into account the medical values unique to the VA. Finally, the independent GAO will be required to review VA's work to ensure that Congress and the agency have an effective roadmap to move forward. Regardless of your votes today, I'd like to extend my gratitude to Chairman Rowe, Dr. Dunn, and Dr. Renstrip for working with my colleagues on trying to find an effective compromise. While I still cannot support the underlying bill in its current form, I hope you will consider my amendment. Thank you again, and I yield back.
I thank the gentlelady for yielding, and while I appreciate the gentlewoman's comments, I will not be supporting this amendment in the nature of a substitute. It would make the bill a pilot program and inserts numerous reporting requirements, including 2 assessments by GAO. To be clear, this bill is based on recommendations that GAO and IG and others have already made in prior reviews of the VA productivity, efficiency, and staffing. Requiring yet more reports would be a waste of taxpayer money and government time. It also most likely leave us right where we are now. Every day that VA fails to ensure that its providers are as productive as possible is a day VA fails to be accessible as our nation's veterans deserve for it to be. What's more, the concerns about the use of RVUs are unfounded, especially considering that VA already uses them. According to VA testimony, the department utilizes what VA calls industry-accepted RVU-based models to track physician productivity for certain specialties, including dermatology, neurology, gastroenterology, orthopedics, urology, and ophthalmology. Those models were first tested in fiscal year 2013 in certain Veterans Integrated Service Networks before being deployed nationwide, meaning that, in essence, the pilot that Representative Custer's amendment would create has already been done. VA has been telling this committee for years that they intend to increase the use of those or similar models for all providers, and this bill would require them to follow through on that commitment. And there's no excuse for any further delay. Do any other members have comments or wish to comment on this? Mr. Walsh, you're recognized.
Thank you, Mr. Chairman. I'd like to take the opportunity to strongly support Ms. Custer's ANS to H.R. 6066. We've stated time and again that comparing the VHA's relative value units against those of the private sector is not an equal comparison. We can end up with faulty information that erode trust of veterans have in their VHA providers. While I appreciate the changes that have been made since we first saw this language and discussion draft, they don't go far enough to alleviate my concerns or the concerns of various stakeholders that have testified in front of this committee. I'd like to ask the chairman for unanimous consent to add the letter of the Nurses Organization of Veterans Affairs sent to me to express their concerns with the underlying bill.
Without objection.
Thank you, Mr. Chairman. I believe a sensible alternative should be the completed part of the pilot program. By allowing VA with GAO's oversight to create and carry out a 3-year pilot program to collect RVUs and establish performance measures, we can determine if the collection is both feasible or advisable. At the end of the day, the ANS would meet the goals of the underlying bill while ensuring VHA is not tied to any faulty or harmful practice. For this reason, I urge my colleagues to support Ms. Custer's ANS to H.R. 6066 as amended, and I yield back.
Thank you, gentlemen. Any other members wish to speak on this amendment in the nature of a substitute? Hearing none, since no other amendments were timely filed, the question now occurs on Representative Custer's amendment in the nature of a substitute to H.R. 6066 as amended. All those in favor say aye. Aye. All those opposed say no. No. In the opinion of the chair, the noes have it, and the amendment is not agreed to. I now recognize Mr. Bilirakis for a motion.
Mr. Chairman, I move that we report H.R. 6066 as amended favorably to the full House.
All those in favor say aye. Aye. All opposed, no. No. In the opinion of the chair, the ayes have it. The motion is adopted, and H.R. 6066 as amended is reported favorably to the full House.
Mr. Chairman.
Yes, Mr. Walsh, you recognize.
Pursuant to House Rule 11, Clause 2, Lima, I give notice of intent to file minority or supplemental additional or dissenting views.
Thank you. I now call up H.R. 2787 as amended, the Vet MD Act. The clerk shall report.
H.R. 2787 to establish in the Department of Veterans Affairs a pilot program.
The bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment. Seeing no one, is there Mr. Takano?
Thank you, Mr. Chairman. When I joined this committee,
He needs to read it.
Yeah, there's an amendment at the desk.
I have an amendment at the desk. Excuse me.
Amendment to H.R. 2787, offered by Mr. Takano of California.
Ask unanimous consent for the reading of the amendment be dispensed with, and hearing no objection, so ordered. I now recognize Mr. Takano for 5 minutes to discuss his amendment.
Thank you, Mr. Chairman. Sorry for getting ahead of myself there. When I joined this committee, it became clear to me that our nation and the VA is facing significant health care shortages. Representative Capter shares those concerns with us. My amendment makes minor changes to make the bill more inclusive. It simply adds another criterion for priority in the selection of participants. If a student indicates interest in occupations where there are large staffing shortages, such as women's health or psychiatric care, the Secretary shall also give them priority. I urge adoption of this amendment, and I yield back.
Thank the gentleman for yielding, and Mr. Takano has been a tenacious, with his education background, supporter of both the GME and physician education in this too, so thank you for your amendment. I will be supporting this amendment, and do any other members wish to comment on this amendment?
Mr. Chairman, if I could.
Mr. Walls, you recognize.
Thank you. Just briefly, I too support Mr. Takano's amendment and add my voice to his tenaciousness on making sure GMEs and everything else for many years has been there. We've heard in various hearings, both VA and the nation are experiencing severe shortage of health providers. We've learned through discussions of this issue that VA must find creative solutions to combat this growing issue. Mr. Takano's and Ms. Capter's underlying bill work together to allow VHA to capture pre-health student interest in professions identified as suffering from staffing shortages, such as mental health, primary care, before beginning medical school. By allowing interested students to shadow VHL professionals, not only are we providing opportunity to college-age students, we're allowing VHA to instill in those students a sense of why the VA is so important. As a former educator, I know how important this is. I'm proud to support this legislation, and would note at this time, too, Mr. O'Rourke's work on this of pointing out how we were missing opportunities for many years started to build momentum to get this. So I urge its adoption, and I yield back.
Thank the gentleman for yielding. Does anyone else wish to speak on Mr. Takano's amendment? And hearing none, and since no other amendments were timely filed, the question now occurs on Representative Takano's amendment, H.R. 2787, as amended. All those in favor say aye. Aye. All opposed, no. Opinion of the chair, the ayes have it, and the amendment is agreed to. I now recognize Ranking Member Walls for a motion.
Mr. Chairman, I move that H.R. 2787 as amended be reported favorably to the House of Representatives.
All those in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it. The motion is adopted, and H.R. 2787, as amended, is reported favorably to the full House. Now call up H.R. 5649, the Navy SEAL Chief Petty Officer William Bill Mulder Transition Improvement Act of 2018. The clerk shall report.
H.R. 5649, to amend Titles 10 and 38, United
The
States.
bill was circulated in advance pursuant to committee rules without objection. The first reading is dispensed with. The bill is now open for amendment. Who seeks recognition for the purpose of offering an amendment?
Mr. Chairman, I have an amendment in the nature of a substitute.
The clerk shall
At the desk.
report.
Amendment in nature of substitute to H.R. 5649, offered by Mr. Arrington of Texas.
Unanimous consent that further reading of the amendment in the nature of a substitute be dispensed with. Hearing no objection, so ordered. And I now recognize Mr. Arrington for 5 minutes to discuss his amendment in the nature of a substitute.
Thank you, Mr. Chairman. We started as a committee with a couple of prevailing thoughts. One is that our country makes a tremendous investment in our civilians as they transition and transform into the most formidable freedom fighters and as part of the greatest military on the face of the earth. But then when they transition out, we spend a fraction of the time and resources to make sure that they take these unique skill sets and experiences and maximize them to be most productive as civilians. So this transition assistance program, we believe, I think I can speak for the subcommittee, is incredibly important because an ounce of prevention is better than the pound of cure in terms of suicide, unemployment, incarceration, and other challenges that are unique to the veteran community. My amendment in the nature of a substitute is to my bill, the Navy SEAL Chief Petty Officer William Bill Mulder Transition Improvement Act of 2018, which was named in memory of a dear friend of mine from high school. It's really hard for me to talk about it, but I will say that he was a warrior's warrior. And you knew that as soon as you met Bill. Toughest son of a gun I've ever met. And when I found out he joined the military and became a Navy SEAL, I felt safer and I felt sorry for the enemy. And I think everybody that knew Bill shared my sentiments. He was a highly decorated combat veteran. Among many recognitions, 3 Bronze Stars with Valor. He struggled when he came back, like many of our warriors, and ironically, his greatest challenge was not on the battlefield. It was coming back home, and it was making that transition. And like a lot of our troops, he struggled with scars that you couldn't see, and that made it difficult, I think, to work with Bill. This amendment represents a piece of the subcommittee's economic opportunities efforts to improve this TAP program. Major changes to the Department of Defense portion of TAP program were originally in my bill, but they've been removed due to jurisdictional concerns. I'd like to thank Beto O'Rourke, my ranking member, for his leadership. Also working with HASC. Also Chairman Kaufman for his work with the House Armed Services Committee, and my friend and fellow West Texan Mac Thornberry for including the changes in the National Defense Authorization Act. The TAP program improvements will affect, among other components, will engage these active military folks in their transition earlier in the process. We'll have a more comprehensive assessment, which will include mental health. We'll customize their civilian readiness programs instead of having a one-size-fits-all. We'll strengthen the connection to community organizations. We know that's a success factor, and we'll track and measure success so we can find out if this is working and where it's working so we can make greater investments in going forward. My amendment also includes provisions considered in the EO subcommittee to help veterans using the GI Bill who were affected by the natural disaster recently, which was proposed by Judge Poe. Also includes elimination of the time frame by which a veteran may access vocational rehab benefits. That was proposed by Ms. Brownlee. Finally, my amendment also includes the text of H.R. 4149, which was introduced by Dr. Winstrip. This legislation will close a loophole in the GI Bill related to flight schools by capping the total tuition and fees that can be used by a public school for flight training at the current private school cap of $23,805. Mr. Chairman, this amendment is fully offset. I believe that these reforms will make an improvement. I will say that I'm very proud that it has the fingerprints of Beto O'Rourke and Mr. Takano and both sides of the aisle. This is truly bipartisan. And I think it's going to help change the lives of many of our service members as they transition. I thank my friend, and again, Mr. O'Rourke, for his support. I thank Sidney Mulder and his 3 children, Bill's 3 children, for letting us use his name and have the honor of using his name as a representative of warriors just like Bill. I also say thank God for people like Bill, men and women like Bill, who are willing to sacrifice their today so we can have our tomorrow. So God bless our men and women. God bless the efforts of this TAP reform. May it go for all the good intentions that we had in mind when we did it. So I yield back.
I thank the gentleman for yielding, and I thank you on both sides of the aisle for the work that you did on this. I think this is an incredibly important piece of legislation, and I hope that it's passed by I hope it stays in the NDAA as it is. I hope the President signs this into law. And Mr. O'Rourke, thank you for your work on this. I remember, and General Bergman now about the same vintage, and I remember my TAP program. When I left the Army at Fort Eustis, Virginia, the gate didn't tap me, where on the way out. Yeah. And so that was about it. I mean, they just said you're signed out and adios, and nobody ever checked again. I think this program, and I met a Marine the other night before I came back he was in the Marine Corps. He separated on Friday, went to work on Monday. He had 2 days off from his time in the Marine Corps that he started work, and he shared with me that was very important for him. He got right to work, had a purpose, had a paycheck. I think what you're all doing, I think you can save lives by doing this bill, and I'm excited about it, and I appreciate all the work. It has my full support.
I would like to open it up now to any other members who may want to comment. Mr. O'Rourke, you're recognized.
Thank you, Mr. Chairman. And I want to thank Mr. Arrington, who as chairman of the Economic Opportunity Subcommittee has confronted this crisis of reintegration of service members head-on and has held countless hearings. I mean, I literally don't know how many hearings have been held, how many roundtables, inviting the participation of veteran service organizations, student veteran organizations, and veterans and family members from all walks of life, holding a field hearing in Lubbock, Texas at Texas Tech, which has been an absolute leader in ensuring that, you used the word, Mr. Chairman, that those returning service members find purpose again in their lives academically, economically, civically, as they engage with their communities. And at a time, and Mr. Arrington alluded to this, that we're losing 20 a day every single day, and that's by the VA's official count after surveying veterans and their family members in 50 states. We are in crisis, and part of that has to be met, as our former VA Secretary David Shulkin did, by making suicide prevention the #1 clinical priority of the VA. But a lot of this is in ensuring that those returning service members have that function and purpose in their lives that they had as part of a military unit. I remember we were lucky enough, and I think at your invitation, Sebastian Younger came and addressed this committee, and he said as a human being, he can't think of a more essential function than that provided as a member of a military unit. What you do or fail to do will determine the life and death of the service members with whom you're sacrificing or putting your life on the line, and then to come back and not have that purpose and function after being as essential as you can be can lead to some devastating, tragic outcomes. So this rewriting of the Transition Assistance Program, both on the Economic Opportunity Subcommittee, and you've participated in many of those hearings, Mr. Chairman, and then to have Mr. Kaufman and Mr. Banks, Mr. Wenstrup and others do their part on the House Armed Services Committee, and we were just, as conferees, meeting with our Senate counterparts to ensure that the necessary provisions are included in the National Defense Authorization Act. This is going to go a long way to returning that purpose and function in lives that deserve it, given the sacrifice and their willingness to put those lives on the line for this country. So very grateful for Mr. Arrington's leadership on this, the committee coming together, Mr. Takano, who's been working on this for the last 5.5 years, really shows why this committee and the House Armed Services Committee are the true last bastions of bipartisanship on the Hill, and why that matters. And as you say, it's going to literally save lives and give those lives greater purpose and function and ability to contribute to the greater success of this country. So I'm very grateful that I got a chance to participate in those hearings and in the writing of this, and urge our colleagues to support passage. Thank you, Mr. Chairman.
Thank you, gentlemen, for yielding. Does anyone else wish to speak on the legislation? You're recognized.
Thank you, Mr. Chairman. And again, I want to thank all of my colleagues for their hard work over the years on this important issue. I want to note that we see in the audience here today, I think, members of TAPS, of the Tragedy Assistance Program for Survivors. And these are the folks, yeah, I'm seeing you nodding out there. You see the neck bands. And we don't want to add to your numbers, right? And we want to help you in every way we can. And I think all of us at home have heard how important these programs can be when they work, but how we need to do a better job of making sure they're accessible for everyone. I'm very grateful to Mr. Arrington, Mr. O'Rourke, and others for including my little piece in this, the Jobs Tools for Veterans Act, to reflect on needing to have these programs available for veterans of all service eras. We know how quickly the economy is changing. People may lose their job. Whole sectors of the economy are getting wiped out. And our commitment to our veterans endures through time and through generations. So to make these programs available to provide that assistance, not only at the immediate separation and transition to civilian life, but also throughout life, to provide that retooling, new upskilling, to ensure that people continue to have lives of meaning and purpose, and we continue to have the benefit of the extraordinary investment and the extraordinary talent of the men and women who answer the call and step up to serve, whether they be 22 years old or whether they be 52 years old. And so again, I want to thank all of my colleagues for their important work in recognizing we need to have a warmer handoff from DOD to VA, and we need to make sure that transition provides every single support we can for those people who serve this country. So again, thank you to those of us for joining us here today to underscore what's at stake in doing our jobs. Thank you very much, and I want to thank the chairman and
Thank you,
yield
Ms.
back.
Hester. Thank you for yielding. Anyone else wish to speak? And Mr. Arrington, Chairman Arrington, I want to thank you for naming this after your friend. I think that was a really great thing to do, and I know his family appreciates it. I know I do. Do any other members have wish to comment? Since no other amendments were timely filed, the question now occurs on the amendment in nature of a substitute to H.R. 5649. All those in favor say aye. Aye. All opposed, no. Opinion of the chair, the ayes have it, and the amendment in the nature of a substitute is agreed to. I now recognize Ranking Member Walls for a motion.
Mr. Chairman, I move H.R. 5649 as amended be reported favorably to the House of Representatives.
All those in favor say aye. Aye. All opposed, no. Opinion of the chair, the ayes have it. The motion is adopted, and H.R. 5649, as amended, is reported favorably to the full House. I now call up H.R. 5693 as amended, the Long-Term Care Veterans Choice Act. The clerk shall report.
H.R. 5693 to amend Title 38 United States Code.
The bill was circulated in advance pursuant to committee rules. Without objection, the first reading is dispensed with. The bill is now open for amendment, and I have an amendment in the nature of a substitute at the desk. The clerk shall report.
Amendment in the nature of a substitute to H.R.
Ask
5693.
unanimous consent that further reading of the amendment be dispensed with. Hearing no objection, so ordered. My amendment in the nature of a substitute keeps the base of H.R. 5693 as amended, the Long-Term Care Veterans Choice Act, which is sponsored by Congressman Higgins. It would authorize VA to cover the cost of care in a medical foster home for up to 900 veterans entitled to nursing home care on account of their service-connected disabilities who VA would otherwise be required to provide care in a nursing home. Medical foster homes provide long-term care support for veterans who are unable to live independently but prefer the smaller, more familial setting of a medical foster home to larger, more institutional nursing homes. VA has been providing in-home care and other support to veterans in medical foster homes for almost 20 years. However, since the VA does not have the authority to pay for care in a medical foster home, the almost 1,000 veterans living in those homes today are paying for them out of pocket, regardless of whether or not they are eligible for VA-paid nursing home care. This has resulted in some veterans who would like to be considered medical foster home care going instead into a more costly nursing homes at VA's expense for purely economic reasons. Medical foster home care is less expensive than nursing home care, and VA estimates that enactment of this bill would result in the cost savings of approximately $99 million over 3 years. More importantly, it would also increase access and promote choice among the increasing number of veterans who are in need of long-term care. I'm grateful to Congressman Higgins for introducing this bill, which has my wholehearted support. My amendment in the nature of a substitute, the text of H.R. 5644, the Veterans Education Transition Opportunity Prioritization Act of 2018, was introduced by Dr. Winstrup. It would authorize the creation of a new fourth administration at VA and the appointment of a new undersecretary to oversee this administration. This administration would be responsible for overseeing VA's education, vocational rehabilitation, and employment, and home loan benefits, and would otherwise oversee VA's portion of the Transition Assistance Program and small business issues. Most of these programs currently reside under the Veterans Benefit Administration, or VBA, and in my opinion, don't receive the visibility to be truly effective. This is because the bulk of the Undersecretary of Benefits time is spent overseeing compensation and pension claims and the backlogs that arise and fall over time. By creating this new administration, we would provide additional oversight and prioritization of those programs that serve veterans' economic needs and help them transition to civilian life. To alleviate concerns about the growth of government, the amendment would set a cap on the number of full-time equivalent employees that can be in the new administration and VBA. This would effectively require VA to set up this administration within existing resources. to pay for the medical foster home and fourth administration provisions, my amendment would also authorize a temporary nominal increase in the funding fee for refinanced VA guaranteed loans. This increase would not impact disabled veterans, and I believe is a reasonable way to offset the cost of the amendment. I thank our friends on the other side of the aisle for working with me on this package, and I urge its adoption. Do any members wish to comment on my amendment in the nature of a substitute? Seeing none, and since no other amendments were timely filed, the question now occurs on my amendment in the nature of a substitute to H.R. 5693 as amended. All those in favor say aye.
Aye.
All opposed say no. In the opinion of the chair, the ayes have it, and the amendment in the nature of a substitute is agreed to. I now recognize Ranking Member Walls for a motion.
Mr. Chairman, I move that H.R. 5693 as amended be reported favorably to the House of Representatives.
All those in favor say aye. Aye. All opposed, no. In the opinion of the chair, the ayes have it. The motion is adopted, and H.R. 5693 as amended is reported favorably to the full House. We have 6 non-controversial measures that can be reported to the House en bloc. Ranking Member Walls and I have agreed in advance that these bills can be moved en bloc. I ask unanimous consent to call up and consider en bloc H.R. 2409, H.R. 5538, H.R. 5864, H.R. 5882, H.R. 5938 as amended, and H.R. 5974 as amended. Hearing no objection so ordered, the clerk shall report.
H.R. 2409, a bill to allow service members.
Bills were circulated in advance pursuant to committee rules. I ask that the reading of the bills be dispensed with, and hearing no objection so ordered. Do any members wish to comment on any of the bills on our remaining agenda? Mr. Boss, you're recognized.
Thank you, Mr. Chairman. As all of us are here today, the mission of this Department of Veteran Affairs is to care for those who have borne the battle. When our heroes in transition from the military, they deserve to have the access to quality health care and services. Unfortunately, VA continues to fall short on that promise, due in part to failures in the human resources offices. This issue hit close to home for me when the VA National Center for Patient Safety surveyed the Marion VA Medical Center in my district. The Marion survey showed a decline in key factors such as communications between management and staff and reporting problems to management. Our oversight subcommittee staff then visited Marion in order to get a first-hand look at the issue of the facility. During that site visit, multiple employees raised concerns about poor management, poor communication, distrust between leadership and management, and the lack of accountability. Despite several efforts to encourage VA headquarters leadership to address these problems, limited action has been taken, and my office continues to receive complaints. The common thread throughout has been an issue with the Human Resource Department. HR management is a critical part of delivering health care. HR is responsible for recruiting and retaining highly qualified professionals, and the current status quo within the VHA's HR offices cannot continue. That's why I introduced H.R. 5864, the VA Help Act, with Representatives Sinema. This bipartisan, straightforward legislation instructs the VA Secretary to establish qualifications for HR positions within the VHA and to set performance metrics for those positions. I urge members of the committee to support H.R. 5864 to ensure that our nation's veterans are being provided the best possible care from the VA employees. And I yield back.
Thank you, gentlemen, for yielding. And Ms. Custer, you're recognized for 5 minutes.
Thank you, Mr. Chairman. I wanted to speak on H.R. 5074. I'm proud to co-lead Mr. Denham's bill, the VA Cost Savings Enhancements Act, as a comprehensive solution that will streamline VHA operations, save money, and improve VA's public health footprint in our community. The bill would require VA to procure on-site medical sterilization equipment if it finds that such equipment would provide for net savings. VA currently has the contractual authority but has had issues justifying the short-term expense to realize long-term savings. With the 2-year non-recurring maintenance funding provided by the balanced budget agreement, now is the time to ensure this equipment is provided to those VA hospitals that can use it. This type of funding will not always exist, and this investment will pay dividends in a few short years. Additionally, this bill will ensure VA facilities finally follow CDC best practices on medical waste disposal. The current system of waste disposal utilized by approximately 75% of VAs risks medical contamination of our communities and provides for a needlessly complicated organization of disposal. I'd like to thank Mr. Denham and his staff for working with my office on this bill. Their willingness to answer our questions and work with me on improving this bill was much appreciated. I urge my colleagues to support the bill, and I yield back the balance of my time.
I thank the gentlelady for yielding. Does anyone else wish to speak on any of these bills?
Mr. Chairman.
Mr. Walls, you're
Just briefly, first of all, thank you for the en bloc amendments. They're all smart. I urge their adoption. I'd also like to thank you and your staff for working with us on H.R. 5882 and H.R. 2409. As these bills move forward, I look forward to making some technical corrections necessary to make sure we include the spouses of service members in the National Guard and Reserve who die in the line of duty. Also making those technical corrections to H.R. 2409 necessary to bring it in line with the changes we're making under 5882. These changes are necessary because it's about fairness and parity. This is part of updating our laws and mindset to reflect a move of the Guard and Reserve to an operational reserve from the strategic reserve. It shouldn't matter what duty status you're under. If you're wearing the same uniform and doing the same job, you should have the same protections. Arcane and outdated personnel management policies at the Pentagon doesn't matter to a spouse who just lost a loved one. We need to make sure their lives are a little bit easier. This year alone, we lost 9 members of the Puerto Rico National Guard in a May plane crash, a member of the Florida Army National Guard in January vehicle accident, and a member of the Tennessee Army National Guard to a training accident at the National Training Center. These incidents hit home to all of us, and as we move into the next Congress, I hope the committee continues to focus on the total force concept and the Guards, men and women, and reservists who do it for each of our districts. So thank you, Mr. Chairman, for this, and I urge its adoption.
I thank the gentleman. I associate myself with your remarks. I now recognize Ranking Member Walls for a motion.
Mr. Chairman, I move that H.R. 2409, H.R. 5538, H.R. 5864, H.R. 5882, H.R. 5938 as amended, and H.R. 5974 as amended be reported favorably to the House of Representatives.
All those in favor say aye. Aye. All opposed, no. The opinion of the chair, the ayes have it. The motion is adopted, and H.R. 2409, H.R. 5538, H.R. 5864, H.R. 5882, H.R. 5938 as amended, and H.R. 5974 as amended are reported favorably to the full House. That concludes
Mr. Chairman, could I?
Yes, Mr. Walls, you're
Pursuant to House Rule 11, Clause 2, Lima, I give notice of our intent to file minority and supplemental additional or dissenting views.
Minority and supplemental dissenting views must be delivered to the committee clerk by the close of business on Tuesday, July 17th.
Thank you, Mr. Chairman.
In summary, the committee has voted to favorably report the following bills to the full House: H.R. 2409, H.R. 2787 as amended, H.R. 5538, H.R. 5649 as amended, H.R. 5693 as amended, H.R. 5864, H.R. 5882, H.R. 5938 as amended, H.R. 5974 as amended, and H.R. 6066 as amended. I ask unanimous consent that members have 5 legislative days in which to revise and extend their remarks and insert extraneous materials on any of the bills reported today. Hearing no objection, so ordered. And I ask unanimous consent that the committee staff be authorized to make technical and clerical and conforming changes to the bills as reported this morning, and hearing no objection, so ordered. And I do want to say one last thing before we adjourn today, and I'm sorry not all the members are here. In 18, 19 months, this committee now has voted out 82 significant bills out of this, 82. 22 of them have been signed into law. That's a lot of work, and I know that our veterans out there, when I go home and speak and tell them that what we've done from claims appeals modernization that has been worked on so hard, to the choice program, to the Forever GI Bill, and on and on and on. I can't thank you enough. People talk about at home, I'm sure they tell you this, that you hear that, oh, I know it's tough working in Washington, you have all this stuff. I said, look, I get up every day, and the members of my committee get up every single day of their life, and they get to come to the capital of the United States of America, the freest country in the world, and work on helping our nation's heroes. That's about as good a job as you can get, ladies and gentlemen, and I just want to share that with you all and thank you for the hard work you've done on this committee. I thank all the members, and we're adjourned.
Well done.